Hello, my name is Robert Reed, and I'm going to take up a few minutes of your time today to explain to you how to operate the Hespera Plum pump. I'm applying for the implementation trainer job. I have several years experience as being a registered nurse, actually 7 years. I've been a clinical instructor for 3 of those years, which is working with adult learners and teaching them actually how to be nurses on the floor in a hospital setting. I work well with teaching. I'm very a patient individual, and I'll be a great asset to your company. To operate the Hespera Plum pump, first we want to look at our dials and our settings on here. You have a dial that goes all the way around. The first first thing the dial points to is the off, which means that your pump is off. We have set rate, which means you're setting your rate for your patient of what the IV fluids are going to actually run at. We have set volume to be infused, VTBI. VTBI does mean volume to be infused. Run is actually you letting it run into your patient. We have hold or reset. Anytime that your pump is beeping, that is how you're going to reset your pump to get it to run again. And we have clear volume, just so that you can clear your volume between shifts, so that you have an accurate account of what your patient is receiving. Along the top, we have primary and secondary, which means you're setting your rate for either your primary line, for which you want to primarily go into your patient, and your secondary will be something like a piggyback or antibiotic that your patient is just getting every so often throughout the day. We have our down and up arrows for just setting the rates. We also have a button over here called Quick Set, which lets you set the rate in increments of 100. It's just a faster way to set your rate instead of having to hold your up or down arrow to set your rate. Below that, we have what we call a back prime if you need to back prime your secondary tubing if it has air in the line, or to back prime the cartridge so that we don't have air going to our patient. Below that, we also have a silence button if the pump starts beeping. When you cut your pump on, you always want to listen for the audible sound just to make sure that you can hear your pump if it starts beeping. To change that sound, we can turn our pump around, and we have what we call back here audible, and we have it on high and low. We always want our pumps to be set on high so that we can hear our pumps far away. Also, we have our lockout. You might have some patients that might manipulate your pumps at times, so we might need to lock them out so that they cannot change our settings on our pumps, because that can be very dangerous to the patients. And you have your lever, which opens your door, which you would slide your cartridge down into and then close it back for your pump to be operational. This concludes the lesson of how to operate the Hespera Plum pump. Again, I would like to thank you for allowing me the opportunity to teach you how to use this pump. And like I said again, I will be a great asset to your company because I have worked with adult learners for over 3 years, training them how to be a nurse in a clinical setting. Thank you. I can be reached at area code 864-237-3217 or by email at mrreid@hotmail.com. Thank you for your time and have a good day.